speaker, Hannah Kuper, recently welcomed her third baby and couldn't be with us today. But she had sent us a recorded message. Hannah is co-director at the International Centre for Evidencing Disability at the London School of Hygiene and Tropical Medicine. Dimitrios was always concerned about her safety because he was constantly traveling around the world, sending back messages, casually mentioning encounters with wild animals and other dangerous adventures. Hannah is going to talk about the wider influence of Dimitrios Trichopoulos and her research work on disability in low-income countries.
Good afternoon, everyone. My name is Hannah Kuper. I'm at the London School of Hygiene and Tropical Medicine. I was one of Dimitrios' doctoral students, and I'm going to be talking today about his wider influence, looking at disability in low-income countries. Thank you so much for including me in the program today. I'm really, really sorry that I couldn't be there, but I'm pleased that I can have an opportunity to speak now. I'm going to start by showing you a photo, which is of Dimitrios with his doctoral students. And I really love this photo for a number of reasons. We'd come from far and wide. I'd come from the UK, but Lauren and Lisa had also travelled far because Dimitrios was receiving an honour at HSPH. And it's a real testimony to how much we cared about him when we're in contact with him that we'd come together at this point. Dimitrios used to tell me not to let a month go past without being in contact with him, and more or less I kept that up over the last 13 years since I stopped being his doctoral student. I also love this photo because it shows how well his students got on with each other and that we were in contact and cared about each other. And the other thing that's really striking is that everybody was working on cancer epidemiology, which has been the topic, which was the topic of their doctoral studies. That is, everyone except for me. I did my doctoral studies with Dimitrios on liver cancer. And quite soon after finishing that, I started to work on disability and blindness in low-income countries, mostly in Africa, but also in Asia. Dimitrios and Pagona found this a bit baffling as a life choice. They didn't really understand why I would want to travel far and wide across the world when there was perfectly good research to be done in the UK or in Europe, also in Boston, obviously. I would write to them about the kinds of adventures that I was having. I once wrote and said that I was staying in a place where I had to keep my windows closed at night because of lions. And they found it very perplexing that I would choose to put myself in this kind of situation. The other thing that they were slightly baffled by was my decision to work in disability. So I'm sure that a lot has been said about Dimitrios' great productivity. So almost 1,000 publications in peer-reviewed journals, which is really astonishing. But if you hone that down to disability, you'll see that there was just 2 publications, which is on the par with his publications about earthquakes. So I seem to have chosen one of the few topics where Dimitrios didn't publish broadly. Now, Dimitrios, I think, was very aware of the importance of disability as a topic, but I think what he questioned was whether it could be a good topic for epidemiological research. And I agree with that concern, that it is difficult to do epidemiological research on disability, which is why there's very little data. But I've really relished that challenge, and I've tried to use the teachings from Dimitrios and applied it to the work that I've been doing, epidemiological work on disability. So first of all, we've started by doing quite a lot of work about how you measure disability and what disability is as the cornerstone for doing epidemiological research. I won't bore you with the details of it, but suffice to say that this was done and we've come up with a working definition that we can use. We then applied this definition to epidemiological studies. Now, Dimitrios is very well known for his work on case control studies as developing the methodology, but also something that he used broadly. And I think that he liked this methodology because it was flexible and quick, so he was able to generate and test hypotheses and refine those further. We've also used the case control methodology a lot in our work, and that's for similar reasons, but also because we've been very resource constrained. There's very little funding in disability, and it's difficult to do research in these very poor settings other than through case control studies. So it is something that we've used a lot. I'm going to describe a couple of the studies. One such study was called the Cataract Impact Study. Now, if you look at the picture of this man, he's visually impaired or blind from cataract living in Kenya. And you can see that he appears to be very isolated and not very well off. It's broadly understood that people with cataract blindness in low-income countries have challenges, but it hasn't been quantified how far. And it's very important to know about that, to try and plan services to see, for instance, at what level of visual acuity it's beneficial to have surgery, and also to use that information for advocacy and for assessment of impact. So we did a study to look at what the impact really was of having cataract visual impairment on people's lives. We undertook it as a case control study across 3 different countries, in Kenya, the Philippines and Bangladesh. We conducted surveys to try and find cases in the community who were visually impaired from cataract, and then we selected controls from the same community, age, sex matched, who were not visually impaired. And we undertook very detailed examination and questionnaires. From that, we were able to look at the relationship between poverty and cataract. Now, bearing in mind these were very poor communities, so mostly people were pretty poor, but we managed to show that even in those communities, those who were visually impaired or blind from cataract were even poorer, whether that was measured in terms of assets or what people owned, in terms of expenditure, so how much money they had to spend, or in terms of self-rated wealth. We could also show that people who had cataract had poorer quality of life and were less likely to be engaged in productive activities. This information has been really useful for advocacy and for planning for NGOs and for organisations in low-income countries. As an aside, these people who were visually impaired from cataract were offered surgery, and we showed that after surgery there was an alleviation of poverty, so that the people became less poor. And we've done a 6-year follow-up and showed that they were still less poor. So here is a man who you can see who'd been operated. If you look at the picture where he's wearing glasses, he's there visually impaired or blind from cataract. And then we went to see him a year later where he was no longer blind. And I'm going to tell a short aside about this person just because it was a story that Dimitrios would have liked. So as you can see in the photo, the man is on the older side. He's blind and he's really not very well off before the surgery. And he had 2 quite young wives. And so the interviewers were a bit perplexed. How could this man have 2 wives in this setting? And so I could hear them going in and interviewing the man, and then slowly started to giggle and talk further with him. And they came out and they said, "Oh, of course, if you talk like that, of course you can have 2 wives." We've also used this case control methodology to look at other aspects of disability. So we've recently worked in Turkana in Kenya, which is an extremely, extremely poor area with great food insecurity. Now, it's believed that children with disabilities are more likely to be malnourished than children without disabilities, but there's been very little evidence of that. So we looked within Turkana, and again we conducted a population-based case control study where we looked at children with disabilities in the communities, and we had controls who were sibling controls and household controls, neighbourhood controls. And we showed that even in this extremely poor area where malnutrition was very widespread, the children with disabilities were twice as likely to be malnourished as those without. Looking at another topic, we used a case control study to look at social protection and disability. So GIZ, which is the equivalent of German USAID, has been investing money in social protection programs in low and middle income countries. And these are really programs to try to alleviate poverty. Now we know that people with disabilities are more likely to be poor and therefore in greater need of social protection programs. So the question was, are they being included in these programs? So we tried to answer this question by conducting case control studies in Peru and Tanzania, and we demonstrated that people with disabilities were in greater need of social protection because they were less likely to work, more likely to be poor and less likely to be at school, but they were not more likely to be included in social protection programs. So we showed quite a big gap. So although there are lots of challenges in conducting epidemiological research on disability, I've tried to apply the learnings from Dimitrios to this topic, which has been very helpful for me to think in terms of what he would advise and what he would do. There are also other areas where I've learned from Dimitrios. So Dimitrios had a very unique working style. It was Noel Coward who said, work is much more fun than fun. And that's very much a description of Dimitrios. Dimitrios loved to work because he was incredibly intellectually stimulated by what he was doing, but also because he made work fun and he surrounded himself with friends or turned his colleagues into friends. And that's something that I very much aspire to doing. There were other ways in which his working style has inspired me, so he was obviously extremely productive, and I think of the kinds of advice that he used to give me. Don't let papers lie around. Submit, resubmit, publish it. Don't make enemies. Get on well with people. And I remember these things that he told me. And finally, I want to talk about Dimitrios as a mentor. So I first met Dimitrios in 1997 when I became his doctoral student, and I was only 22. I was incredibly fortunate to have him as my mentor. He spent an enormous amount of time with me, teaching me things as a true apprenticeship. He taught me about writing papers, about doing analyses, about navigating the very complex pathways to journal submission. And I'm very grateful to that. He was aware that he was an unorthodox mentor, that you would spend lots of time with him. So he was concerned about whether or not that's exactly what I would want going in as a doctoral student. So he asked Lisa Signorello to talk to me about the very, very bad things about him as a mentor. So he said to Lisa, tell her the worst things and then she can decide whether or not she wants me to be her supervisor. So Lisa took me out for coffee and she started trying to tell me terrible things about sometimes you have to work on the weekends, or sometimes he'll phone you because he's confused about something at the bank and you can go and help. But very quickly Lisa ran out of bad things to say and she stopped and she said, I would work for him again in a heartbeat. And I remember that almost 20 years on, her saying that to me very clearly. And I really echo that feeling. I was very fortunate to have Dimitrios as a supervisor, and I would have done it again in a heartbeat. So thank you very much for listening to my talk. Thank you very much for including me in the program, and I hope you've all had a wonderful day.